Hi again, I'm Dr. Robert Ang, and together with Dr. Pavol Vesely, we're talking about refractive surgery. In previous episodes, we've gone over patient communication strategies and options in refractive surgery. And in this video, we're wrapping up this series with something even more exciting.
That's right, we are talking about outcome optimization before anyone sets foot in the OR. Dr. Ang and I will go over preoperative measurements, biometry, and communicating with patients to match the right eyes to the right surgery.
I think we're very dependent on preoperative measurements. So we are indeed very dependent on our optometrists to make sure we are correcting the correct powers, and our technicians to supply us all the needed data so that we're sure that when we proceed, we do the correct thing.
Well, I believe the eye, before any kind of surgery, should be examined deeply and as much as possible. So we have a set of examinations that we do on every single patient, no matter what the treatment he is coming for, either cataract, laser refractive surgery. No, we still want the same data because you never know if you would need the data after the surgery. So we do pick up or we do harvest all the possible data that are available with our devices. Even the coma is such an important value for me when I think of any kind of surgery. Coma is probably, from my perspective, is very important, even for the laser refractive surgery, because coma could be the very first sign of keratoconus. So you need to have all the data available to make a patient-responsible decision.
Having a keen eye on the diagnostics is important. Sometimes one device, for example, a topography, can show clear, but in another tomography, there's something suspicious, right? So we have multiple machines to actually find as much factors in disqualifying the patient for LASIK, right? I think that's doing shortcuts is something that maybe less experienced surgeons will have, is, oh, this is enough and let's go. Or shortcutting screenings. We hear some practices don't check the retina because they want to do surgery on the same day. You want the patient to be convenient and do it the same day, but it's a disservice in terms of minimizing risk. So I tell the juniors that you always need to always have patience and experience in interpreting the measurements. That's how you get better. And in the end, it's for the patient. What's your process for assembling criteria and putting together a patient profile to decide on treatment? Do you have like a nomogram?
We do have a nomogram. That means strictly written rules. What should they do? What should they follow? If it's A, do go to B. If it's B plus, go to C minus, etc. There is a decision tree. On the other side, it's very well that also medicine is not carpentering. It's a way where you also have to have little emotion, and a sense of intuition is very important. So if I see that, okay, this is something, although the values are okay, but still there is something I'm concerned about, I'd rather run the patient through the examinations once again. How do you discuss risks and complications with the patient?
So whenever I talk to the patient about their options, so for example, they're probably qualified for all the corneal refractive surgeries, they're even qualified for ICL, something like that. So one by one, we have to tell them I just tell them the unique complications of each. For example, if LASIK, I tell them there's a chance of ectasia, and what is ectasia, and probably the percentage of ectasia in my practice because of our screening process. We have to be open to saying the complications instead of not discussing it. Now, and then I go to the general complications, like we don't want infection, so it's general for all the procedures that you don't wash your eye or rub your eye for the first few days, something like that. We have to kind of pull them to the ground and tell them that this is a medical procedure and they have to contribute to a good outcome, not just us. So both of us will contribute to the good outcome. Where does long-term cost benefit for the patient come into play in the preoperative conversation?
I believe that you should not be hustling with your health. If the patient already is in the house, he or she already went through a decision process, and is ready to undertake the surgery. The only way he wouldn't undertake the surgery is that he wouldn't be eligible for the surgery. Surely we inform the patient about the costs.
I discuss options, and then after I discuss options and answer all questions, they go to the next step, which is our surgical counselor for pre-op counseling in terms of what they need to prepare and the costing and the schedules. But I answer the medical questions first before I hand over. It's very tricky for doctors to be salesmen, so we don't want to do that.
Very right.
Yeah, but we want to be advocates of maybe the most that I will do is rank the procedures according to what their concern is. So some patients, their concern is quick recovery, which is fast. Number 2 is which is more safe, or number 3, which is what they hear about is the best. So maybe the most is I will rank it according to first option, second option, and then you go home and think about it. We should not make this a decision of what's cheaper or what's more expensive. We are there to give the best procedure possible, but the patient will decide and tell us what to do, and then we'll do it for them.
I'm very happy that the refractive surgery, at least what you said, and what I heard here already, is keeping the same rules all over the world. I mean, that's very good because the procedures and the treatments and the pre-op exams are very standardized, and that is a very good thing, not only for us, but also for the patients. The patients is getting the same result, no matter if he would undertake the surgery in Philippines or in Slovakia, but also, if I would refer my patient to you, you would know from the assessments I did that the surgery was done in a correct manner. And that is a very good thing for a worldwide refractive surgery. I'm very happy we had this conversation. That this is it for us. Thanks so much for watching. We hope this independent medical education series will help elevate your refractive practice. I'm Pavol Vesely.
And I'm Dr. Robert Ang. And thank you for watching. And Pavol, it's good that we do the same thing all over the world. That means patients will come anywhere and they will get good treatment in whichever part of the globe you're in. Thank you very much.
Thank you.